Hello everyone, welcome to FMT Guru. We are going to discuss INI-CET May 2022 FMT questions in 30 minutes. I am going to discuss the question, the option and related important MCQ that can be asked in NEET PG exam. The question number 1, the ridge pattern of fingerprint appear between dash weeks of intrauterine life. Option A 26 to 28 weeks, option B 12 to 16 weeks, option C 24 to 28 weeks, option D 32 to 36 weeks. So here question is appear between. So whenever question asked appear between, your answer should be that is 12 to 16 weeks of intrauterine life. The reference is KSN Reddy, 35th edition, page number 62. It is clearly mentioned appear between 12 to 16 weeks of intrauterine life. But if the question asked complete formation occurs by 24 weeks of intrauterine life. Let's discuss about fingerprint. It's very commonly asked in NEET PG, FMGE and INI-CET exam. So now here the fingerprint system, it is also known as dactylography. It can be asked in upcoming exam. It is the most reliable method of identification. We discussed many times in our classes. Appear between 12 to 16 weeks. Complete formation occurs between around 24 weeks of intrauterine life. So this can be asked in upcoming exam. The proof of identity in comparison, what are the points required? So the 12 points are required according to Lockhart. And one more very commonly asked question, that is types of fingerprints. We discussed many times in our classes. There are 4 types. The first one is the loop. You can see here, this is a loop. Why? Because it is loop, because the entry point and the exit point are on the same side. You can see one delta and one core. You can see here. So loop is the most common fingerprint, around 60 to 70% of the cases. It can be ulnar loop or radial loop. Entry and exit points on the same side. It has one core and one delta. It can be asked in upcoming exam. So it has one core, that nothing but curving ridge, and one delta where there is a convergence of ridges from 3 direction. So this can be asked in upcoming exam, delta and the core. One core, one delta, that is loop. The second one is about the arch. And third one is that is the hole. You can see here hole. Let's see what is hole. The hole is around 30 to 35% of the cases. The ridges may complete circle. Whenever question given ridges may complete circle, then it is hole. There are 2 deltas are present. So this can be asked as a MCQ. Whenever there are 2 deltas are there, then it is hole. Okay. And the third one, that is the arch. It can be plain arch or it can be tented arch. It is around 5 to 10% of the cases. There is no core and there is no delta. No core and no delta. And the last one is the composite. Composite means mixed. So around 2 to 3% of the cases it is composite. There should be at least 2 different pattern other than the basic arch. So this is about the in and around the question. Question number 1, that is the dactylography. Let's see second question. So second question, again it is a very commonly asked question and we discussed many times in our classes. There may be some changes in the option and the question frame. Don't worry about that. Worry about the topic, that is the arsenic poison is the question asked. In chronic arsenic poisoning, following clinical features are present. So option A, Aldrich means line, We discussed many times in our classes. Aldrich Mees lines are the white color lines seen over the nails. They are seen. Raindrop pigmentation, one of the very important feature that can be seen in case of arsenic poison. Mixed neuropathy, yes, we discussed many times. There is a neuropathy in the arsenic poison which is mixed. There is a motor neuropathy and sensory neuropathy. Remember, in lead poison, there is a pure motor neuropathy. Luminescent vomitus, that is not seen. Luminescent vomitus, that is seen in case of yellow phosphorus poison. Bone marrow depression, yes, that can be seen. So the correct answer is 1, 2, 3, 5. The answer is, that is A is the correct answer. Let's discuss some more important points about arsenic poison because it's very commonly asked. Let's discuss only images. So look at this. There is one image on the left side, which is nothing but the black foot disease. Black foot disease, last year there was a question about black foot disease. And one more question, there was a question about this compound, so which is a colorless compound which is known as ideal homicidal agent, that is arsenic trioxide. And one more compound you can see here, this is the green color compound which is copper arsenate, also known as Scheele's green. So this is the Paris green. Paris green is copper acetoarsenate. And the white color compound which is also known as Sankhya or Somalkar, fatal dose is 120 to 200 milligram. And you can see one more picture here. This is nothing but the Aldrich Mees line, very commonly asked. Aldrich Mees line. And one more. So you can see here some more images. So you can see on the left side. So this is known as raindrop pigmentation. You can see here raindrop pigmentation, very commonly asked. Please remember one more point in arsenic poison. There is a garlic odor that is seen, and also there is a red velvety stomach. This is red velvety stomach, and there is a garlic odor that is seen, garlic smell that is seen while opening the cavities. And there is one more important finding. You can see there erythromelalgia. We discussed many times. And the drug of choice in case of chronic poison and in case of acute poison, we use ball as a treatment. You can see this. So this is the ball. We discussed many times. So ball has a sulfhydryl radical that combines with the arsenic and that get excreted in the urine. You can see here 3 carbon atoms, 2 sulfhydryl radical, that is nothing but dimercaprol or British anti-levisite, which is drug of choice in arsenic poison. It is given orally or it is given intramuscularly, never intravenously. We discussed many times in our classes. Okay, yes. Now question number 3. Identify the mechanical injury given in the picture. So the picture which I got from the students. So there were multiple cuts were there over the forearm, and there was a main cut at the center. So this is probably a case of hesitation cuts. Okay, hesitation cuts. Hesitation cuts are type of incised wound. They are suicidal incised wound seen over common site is the forearm. It can be seen over the neck also. It can be seen over the feet also, over the lower limb also. So probably the answer for this question is hesitation cuts. Whenever you see it, when a deep injury surrounded by small incised wound, superficial incised wound, it is a hesitation cuts. So it is not graze abrasion. Let's see graze abrasion how it looks. It is not sixpenny bruise. Let's see how it looks in the next slide. And it is not patterned abrasion. Let's see now. So look at this. This is actually a graze abrasion. So see, this is actually the patterned abrasion. Okay, this is actually patterned abrasion. Patterned abrasion. So patterned abrasion, also known as imprint abrasion, where you can see some tire mark, radiator grill mark over the over the epidermis. So this is pattern abrasion. You can see the tire mark. Okay, you can see the imprint of the weapon. So that is the pattern abrasion. And this is sixpenny bruise. Sixpenny bruise. Sixpenny bruise are seen in throttling. Again, it is asked in last year exam. It was asked, actually repeat question. Sixpenny bruises are seen in the manual strangulation, that is throttling. And you can see here parallel lines. So whenever you see parallel lines caused by a road traffic accident, it must be graze abrasion. Okay. So this is how the graze abrasion looks. The graze abrasion is also known as brush burn. So, and again I'll repeat, sixpenny bruises are seen over the neck in case of manual strangulation. Pattern abrasion is nothing but that is imprint abrasion. One example is the tire mark. Graze abrasion characterized by parallel lines. So it can occur and occur in case of road traffic accident, and it is also known as brush burn. Let's see the fourth question. Following is used to identify the vaginal cells. So again we discussed many times in our classes, vaginal cells, they are rich in glycogen. They are rich in glycogen on the glans penis during the examination of accused of rape. Options are precipitin test, Florence test, Lugol's iodine, TOLUDIEN blue. So answer is here, it is answer is C, that is Lugol's iodine. Lugol's iodine is the correct answer. Lugol's iodine that is used to identify vaginal cells over the penis, especially over the glans penis. Let's see now what is this method. So this is the Lugol's iodine. Lugol's iodine. So you need to apply the Lugol's iodine vapor into the filter paper. So first you need to cleanse the organ with the filter paper, then exposing the paper into vapors of Lugol's iodine. If there is a color, brown color, then that shows that there is a presence of vaginal epithelial cells in the specimen or on the surface of the glands. So because of the glycogen, it is positive up to 4th day. Positive up to 4th day. This was the question asked. This is the repeat question asked 2 years back in the INI-CET exam. So the answer for this question is Lugol's iodine, which stains the vaginal epithelial cells. The cells are rich in the glycogen. They are used in the examination of accused of rape. Remember, accused of rape comes under 53A CRPC. 53A CRPC. This can be asked in upcoming examination NEET PG. What is precipitin test? Option here, precipitin test. The precipitin test, it is used for species identification. Again, it is asked in one of the exam. What is Florence test? The Florence test, you can see here, the Florence test. The Florence test is a test for the, that is the seminal stain. So in Florence test, we use potassium iodide. The potassium iodide combines with the choline that is present in the seminal vesicle. It forms the choline iodide crystal, which you can see here, dark brown rhombic crystals you can see. So whenever you see dark brown rhombic crystal, that is nothing but the crystals of the choline iodide that confirms there is a secretion from the seminal vesicle. So this is also asked in recent exam. And TOLUDIEN blue, it is asked 3 years back in INI-CET exam. TOLUDIEN blue is used to identify micro injuries present on the, that is genital area around the anal area. So it stains the genital and perianal injuries. It shows residual blue color whenever there is a presence of the micro injuries. Okay, this is about the question number 4. So question number 5, identify the poisonous plant having yellow flower. Remember, yellow flower can be seen in yellow oleander, but here the seeds are contained in a pricky capsules. So the word here is the pricky and yellow. So you can see this is the pricky poppy plant. So this pricky poppy, nothing but Argemona mexicana. So answer for this question is Argemona mexicana, also known as pricky poppy plant. The seeds are confused, or seeds are mixed with mustard oil. So during adulteration of the oil. So answer for this question is Argemona mexicana, no doubt. Same picture, I think it was asked in the exam. Now let's see now other options. Nerium odorum. Nerium odorum, it is nothing but the oleander. So that is the pink oleander. So that is actually a cardiac poison. This is how it looks. So this is the Nerium odorum. So Nerium odorum looks like this. It's a cardiac poison. Papaver somniferum, it is nothing but the opium plant. Let's see how it looks. So this is how it looks. Papaver somniferum look like this. Calotropis procera. So it is nothing but again organic irritant. It looks like this. So nothing but the madder juice. So answer for this question is Argemona mexicana. Let's discuss one or two points about Argemona mexicana. It can be asked in upcoming NEET PG exam. So let's see Argemona mexicana. It is leaves are sessile, spiny, thistle-like. Seeds are dark brown, globular, smaller than the mustard seeds. So it is mixed with the mustard oil. So that leads to increased vascular permeability. That leads to edema of the face, edema of the body, anasarca. So blurred vision. So that is known as epidemic dropsy. So this can be asked. Argemona mexicana causes epidemic dropsy. So plant that contain two alkaloids. What are they? Berberine and protopine. And the seeds contain sanguinarine. Please remember, sanguinarine is the alkaloid or dihydrosanguinarine. Oil causes epidemic dropsy. What are the clinical features? Clinical features are edema of the legs, diarrhea, anasarca, myocardial damage, dilatation of the heart, tingling numbness sensation, hyperesthesia, enlarged liver, bluish mottling skin. So all these are very important point. Please go through again and again. So this is about the question number 5 briefly. Question number 6. Treatment of acute arsenic poison. So options are dialyzed iron, freshly prepared hydrated ferric oxide, calcium EDTA, dimercaprol. So dialyzed iron, nowadays we are not using this. Ferric oxide also we are not using this. Answer is dimercaprol orally or ball orally. You can use penicillamine also. You can use DMPA or DMPS also can be used. So this is question number 6. Question number 7. I think this is the new question asked in exam. Question number 7. In case of alleged murder of A by B, I think there was some question frame was different, maybe Sham or Ram it is. So A by B at certain place on a particular day, particular time, C saw B with a knife. So C, he just saw B with a knife. He is not witnessing the crime. He is not witnessing the actual fact that is the murder. He just saw the B with a knife on that day at that place a few minutes before the murder. So he is not the eyewitness of the crime murder, but he just saw B with the knife. So what it is? So this is evidence. Option A, direct evidence, indirect evidence, hearsay evidence, hostile witness. Definitely all of you not hostile witness. Hostile witness is, we can remember, we discussed many times in our classes. Hostile witness means U-turn witness. So U-turn witness. Hearsay evidence, no. The correct answer is indirect evidence or circumstantial evidence. So it is not the direct evidence because he is not the eyewitness of the actual fact, that is the murder. He just saw B with the knife. So it is a circumstantial evidence or indirect evidence. Let's see now what are the types of the reference for this question and also answer is Case and Reddy 35th edition, page number 8. You can just go through the lines. So what is given in Case and Reddy? Types of oral evidence. The first one, direct evidence. Evidence of a fact which is actually in issue. Like example, rape, murder. So evidence of the fact which is actually in issue, that is direct evidence. So example, eyewitness statement who was at the actual crime scene of murder. Indirect or circumstantial evidence. It is not the direct testimony of the eyewitness. It is not a direct testimony of the eyewitness about the murder. The court is going to draw the logical inference from the information presented to the judge. So the best answer for the question, the question answer is circumstantial evidence or indirect evidence. One more is hearsay evidence. Hearsay evidence, evidence obtained from the third party. So again, there are three types of oral evidence: direct, indirect, also known as circumstantial. Third one is hearsay evidence. Hostile witness, so U-turn witness. So one who is not revealing the truth or telling lie, so hostile witness. Following are muscarinic manifestation of organophosphorus poisoning except. So here there may be some change in the framing of the OP. So but remember, OP is very commonly asked in exam. We discussed many times in our classes. So please remember, following are muscarinic manifestation. Muscarinic. So there are muscarinic manifestations and nicotinic manifestations. So except is the question asked. Yes, so there is a diuresis, urinary incontinence because of the relaxation of the sphincter. Yes, it is a true statement. So it is not the answer. Not the answer. Bradycardia, yes. Bradycardia or tachycardia can be seen. Yes. Bronchoconstriction, yes. Bronchoconstriction that is seen. Yes. Answer is mydriasis. So as we know, all of you, meiosis is seen in case of OP poison, not mydriasis. Very simple question. Let's discuss in and out of organophosphorus poison because this can be asked in upcoming exam. Yes, organophosphorus poison. So they are classified into aryl phosphates or alkyl phosphates. Example, malathion is a alkyl phosphate. Parathion is a aryl phosphate. What is the mechanism? Mechanism is irreversible inhibition of acetylcholine esterase. Normal level is 4000 to 10,000 international units. What is the fatal dosage? Very less, it is around 1 gram. Malathion it is 1 gram. Parathion it is 175 milligram and the fatal period is 24 hours. What are the clinical features? The mnemonic is sludge match. Very old mnemonic. S for salivation, seizure, sweating, lacrimation, urination, diarrhea, gastric upset, emesis, meiosis, areflexia, tachycardia, cramps, chromodacruria, red color, tears. That is also asked in exam. Hypertension. All these are the clinical feature. Mnemonic is sludge match. It can be muscarinic or it can be nicotinic symptom. Treatment, drug of choice is atropine. Atropine should be given in the beginning. After that, you can start oxymes, prolidoxime or diacetyl monoxime. Not before the atropine. Once you start atropine, you can give oxymes. After that, you can give diazepam for the seizures. So, treatment is atropine, palm, dam, diazepam. What are the postmortem finding? One is the congested organs, froth at the mouth and nostril, and also you can see the cyanosis also. Cyanosis, congestion, petechial hemorrhages, kerosene like smell. It is asked in one of the exam last I think 2 years back. Kerosene like smell because of the aromax which is present in the OP poison, or froth which is blood tinged. So one more, Jamaica ginger paralysis. So that is alcohol that is mixed with the OP poison. So this is about the in and out of the OP poison, and go through these lines again and again. This can be asked in upcoming exam. So this is malathion. What is the fatal dosage of malathion? That is 1 gram. So what is the finding here? Froth. The froth around the mouth, it can be seen in various conditions. It can be seen in snake bite, it can be seen in OP poison, it can be seen in drowning, n number of conditions. So yes, this is about the question number 8. Question number 9. Which of the following is not the feature of cocaine intoxication? Again, the framing of the question may be different, but the topic is same. We discussed many times in our classes. So which of the following not the feature? Yes, hyperthermia, well known, it is hyperthermia that is seen. We know. Hypertension also seen. Tingling numbness also that is seen. But constricted pupil, no. There is a tachycardia. So answer for this question is B is the correct answer. Okay. Constricted pupil, no, it is dilated pupil and there is a tachycardia that is seen. So because of tachycardia, hypertension, there may be intracerebral hemorrhage and sudden death also can happen in case of cocaine poison. Let's discuss about cocaine poison in and out. So in 1 or 2 minutes. Cocaine is also known as crack. It is also known as snow. What is the fatal dosage? 1 gram. It is obtained from Erythroxylon coca plant. Snorting, so or the skin popping. So this is the snorting is the one method of taking the cocaine, or skin popping. You can see the skin popping here. It is a aphrodisiac. It is a well-known aphrodisiac. It increases sexual desire. Okay, like example Spanish fly. It is asked in exam. Aphrodisiac. Crack. It is a smokable one. There is a stage of excitement and stage of depression. In stage of excitement, there is a hypertension that is seen, which can lead to intracranial bleeding and sudden death. And in case of stage of depression, the cause of death is respiratory failure. So respiratory failure that can be seen. The drug of choice is amyl nitrate. Amyl nitrate is given in case of cocaine poison. One more very commonly asked in case of cocaine poison is Magnon symptom. Magnon symptom. The Magnon symptom is very commonly asked. So Magnon symptom. So this is asked in last exam. Magnon symptom. What is Magnon symptom? Tactile hallucination. So what is the finding? The finding is multiple scratch marks over the body. So this is the Magnon symptom which I am showing here. So it can be seen in case of cocaine poison. So yes, next question. A 27-year-old comes to emergency with a salivation. Again the question about OP poison. Salivation, diarrhea, watery eyes, lacrimation, dysuria. What will be the first line of management? So answer is drug of choice. Atropine is the correct answer. Pralidoxime and obidoxime should not be given before atropine. You should start those after the atropine. So answer for this question is B is the correct answer. Again the question about OP poison. Go through OP poison so in detail. It's very commonly asked. Question number 11. Most characteristic feature of muscarinic symptom in organophosphorus poisoning among the following. So options are, so the most characteristic. So most characteristic in OP poison, so there is a respiratory symptoms. What are they? There is a salivation, rhinorrhea, bronchorrhea, bronchospasm. So I'll go with the option A because this is the one of the commonest finding and this is one of the finding which leads to death, which cause respiratory difficulty. See, mid-radic pupil not the answer because there is a meiosis. Tachycardia, bradycardia, yes, both are seen. I will go with option A only. Skeletal muscle contraction, so muscle fasciculation, all these are the important feature of nicotinic symptom, not the muscarinic symptom. So I will go with the option respiratory symptoms. Question number 11. Question number 12. Which of the following causes hypertension? Again, so the question framing may be different. So, but again, hypertension, hyperthermia, all is caused by cocaine only. Cocaine only. We discussed many class. It is not acute alcoholism. It is not opiate poison. It is not acute arsenic poison. So I'll go with the answer cocaine. So this completes the 12 questions. So in a brief period of time, around 30 minutes. So happy reading. Wish you all the best for upcoming NEET PG exam. Thank you.